Hello, happy Friday. Welcome to the Coaches Collab. I am Melissa Knievel-Natanson, and this is the place where we have real talk about real pets and our real reasons for becoming holistic pet health coaches. And today I am happy to be joined by colleague and fellow holistic pet health coach, Carolyn Grenier. Hi, Carolyn.
Hi, Melissa. How are you?
I'm doing okay today. How are you?
I'm doing good. I'm happy to be here with you.
We've got the West Coast, East Coast thing going on
Yes,
today.
we do. Yeah. It's like
You're East Coast, I'm West Coast. Yeah. Well, I am glad that you could join nonetheless, even if we are so far apart. That's one of the amazing things about this program, that even though we are so far apart, we are still able to be connected and do these kind of things. One of the wonderful things of many things about being a holistic pet coach and being under Dr. Ruth Roberts' program. So, Carolyn, speaking of that program, I want to hear about your journey and kind of where this started off. And I know that we've had prior discussions before that some of your own health issues were what spurred you to look more into holistic care. So can you kind of take us through that story?
Yeah, well, actually, it's kind of both like me and Nigel's health issues. So,
and Nigel's her. Tell us about Nigel so we know who Nigel is.
Yeah, Nigel's my big boy. He's 12-year-old Lab and Husky mix, so that I fostered when he was 2 months. So I've had him, for 12 years almost. He's 12 years. I've had it since October 2012. So, it was kind of a little bit of both. I mean, I've always, been a person that's kind of like taking care of my health, like eating well, exercising, and all the, basic stuff. But, sometimes I thought I was eating well, but, there's a lot of things that I did not know, like, seed oils, for example. I was consuming some of those, and with educating yourself constantly, you realize, okay, well, it might not be that healthy what I'm eating. I think it is, but so you have to constantly search and do your research. So I was kind of like just like on a healthier path. And then Nigel in 2018, at the beginning of the year. Nigel was a pretty healthy dog, nothing had really happened to him, major. So until it was 2018. Yeah, 2018. So he tore his first knee ligament, his cruciate ligament.
Oh boy.
Yeah. So from there,
he was how old when that happened?
He was 5 years old when that happened. So it was in January 2018. So then we saw the vets who told us, did the x-rays, and then they recommended the surgery. We went to see the surgeon to talk about the surgery, which was the TPLO surgery that was recommended. That's probably the most common surgery for that type of injury.
Can you tell all of our friends that are watching today what TPLO surgery is?
Yeah, so basically the TPLO stands for tibial plateau leveling osteotomy. So when the ligament, yeah, I know those words. I have a whole folder called TPLO with all of Nigel's information in there. So it's actually when the ligament, the cruciate ligament, is what's kind of holding the tibia and the femur from, to stay in place and from moving. So when the ligament tears, then there's an instability between the bones that start to move, and then it becomes, painful and uncomfortable for the dog to walk. So they have to like restabilize the knee and the two bones together. So they kind of go in and they do they drill, and they're going to put an implant and create the same angle as the normal angle of the back leg, the back stifle of the dog. So they have to recreate the perfect angle. So it's a pretty harsh surgery because you're drilling into the bones. So it's, it's not like just a quick tying up something. You're drilling, you're making holes, and I still have I can show.
I mean,
this is what.
Whoa!
Yeah, I don't know if you can see it well, but that's the.
And, just like on a side note, while you're showing that, this is, there's a lot of parts of vet care that we appreciate so much. We appreciate vets, and this kind of technology is one of those things. If this would have happened to him 50 years ago, there wouldn't
Yes.
be a solution.
Yeah, there would be probably something different, but
Yeah.
so we went ahead and we did the surgery, without really, doing so much research on it. So I, was nervous about it, and I guess I had a reason to be nervous because it did not really turn out as planned. So we had some complications. One of the complications was that the drill bit that was used to drill the holes broke inside of Nigel's bones, and
Oh,
the
Carolyn.
yeah, so the surgeon was not able to retrieve it because it was too fragile. They could have caused, like, because it happened towards the end of the surgery, so there was already a couple holes that were drilled and screws that were placed in, so it would have been a little too risky to break the bone. So the drill bit was left there, but the surgery that usually takes about an hour and a half max took like over 4 hours.
Oh my gosh, Carolyn, you must have just been beside yourself.
Yeah, I was waiting for the call, like they call you when they take your dog in surgery. So I knew what time he was going into surgery. So I'm like, okay, in about an hour and a half, I'll get a call back. And you're like anxious this whole time. You want to know everything went well. And
Right.
so 1 hour and a half, 2 hours, 2 hours and a half, no call. So, I'm calling. They're like, oh, he's still in surgery, he's still in surgery. I'm like, okay. I was starting to like panic inside of me, like what's going on. And then I kept calling, and then 4 hours later, a little bit over 4 hours later, finally I was able to talk to the surgeon, and he said, yeah, it took a little bit longer, everything went well, we just had a little thing, like the drill bit broke, but overall, like, and then he just started, like, kept going, like he kind of said it really quick so I would not pay too much attention to it. But I said, no, wait, what did you say again? So he told me about the drill bit. So I was like, I was kind of upset. I was like, how is my dog? Is my dog okay? And usually they keep your dog overnight. So I was not going to see my dog until the next day.
Yeah.
So I said, I'm coming over right now. I want to know, I want to know that my dog is okay. So
understandable. Yeah.
So I drove there to go see that Nigel was okay. So he was fine and everything, but poor thing, he had been in a long surgery. So normally the recovery for this is about 3 months. But after 2 weeks, Nigel was not getting better. He was still limping a lot. And it was like, it's just like, I could tell that there was no improvement. And I'm like, okay, what's going on? So we went to see you go back normally for a 2 weeks post appointment after the surgery. So he said, well, he probably has patellar tendonitis that got inflamed a little bit. It might come down, put him back on Rimadyl for a couple of weeks. Then we did that. Then shortly after that.
Just to clarify, Carol, sorry to jump in real fast. So at this point, were you on a holistic path with Nigel at that point?
Not quite yet. I was trying to be, like, I was not excited to put him through surgery and all these meds and the antibiotic right after and all that. I'm like, oh, I don't, I'm not crazy about it, but you have to, after this kind of surgery, you can't forgo the antibiotics, and
right.
Sometimes it's necessary, but I was still not, excited about that. I knew I was going to have to, like, clean that up a little bit, like, after the fact. But so then the next thing that happened is that the incision started to have like some kind of pus coming out. So we went back. There was an infection. I don't want to make the long story, but there was an infection that was cultured, and then we were given again a really, really strong antibiotic that for like 5-6 weeks. So then I was like, oh my God, I have to put my dog on antibiotic. Like, that's gonna mess up his gut so much. Like, he's already been like on all these meds. And So, but there's an infection, when there's a surgical plate, it's you kind of have to fix it, right? So that didn't really fix the problem. I mean, it might have got him a little more comfortable for a little bit, but not perfect. Like he still was not putting weight on the leg and still was not walking properly. So anyway, I went to a couple different surgeons that all had a different opinion, and nobody could really quite figure it out. And during all this time, Nigel had been he had started with Rimadyl before the surgery, then the anesthesia meds, then the antibiotic and pain med after the surgery. Then he was put on Rimadyl again because of the patellar tendonitis, then the chloramphenicol and other antibiotics. All of this messed up, his immune system. So he started having I forgot to actually mention that when I was talking to Dr. Ruth, but he started having like major allergies, like intense allergies, like constant licking, constant like nose, runny nose all
And
night.
we know why that is now, right?
What's that?
I said, and we know exactly
Oh
why
yeah.
that is.
Yeah, I know exactly why that is now. So it
That
was
all has to do with the microbiome
yeah,
and skin allergies. We know
yeah,
that the microbiome is out of balance. One of the first places that we see it is the skin. And Nigel, he was on a
yeah,
lot of antibiotics, so that balance was definitely disrupted.
definitely. And it was like, unbearable. He was not sleeping. I was not sleeping. It was like all day, all the time. So, all these bombarded with all kinds of meds here and there and antibiotics, it does affect your immune system in a bad way. So,
Yeah. What
we
was your,
ended up,
oh, I'm sorry, go ahead.
no, go ahead.
I
You
was
go
going to
ahead.
say, what was your turning point when you were just kind of like, all right, I've got to see if there's a better way. Is there another path I can take?
Yeah, well, that happened kind of like after, like, so when this happened, like, and nobody could figure out, like, uh, I was sent to a surgeon, and the vet where we were doing physical therapy said, why don't you do a CT scan to see what's going on everywhere, because there's a lot going on. He's not getting better with his knee, then all the allergies. So she sent me and she said, make sure you talk to him about the knee. Make sure you talk to him about the knee. So she sent me to see that clinic. I did not know I was going to see a surgeon, but the doctor she referred me to was a surgeon. So when I got there and when I met him right away, is like, I know exactly what's going on, why your dog is not, his knee's not getting better. And then it's when he explained to me that when there's an infection at a surgical site, it creates biofilm where the bacteria they can hide, and when there's like screws with those little rims, they can hide in those little places, and it's harder for the antibiotics to get to those and to kill those. So usually the solution to this is to remove the implant. So that was that's where we ended up, is we ended up having to remove the implant. And sure enough, like right away, like, the first day I picked him up, I could see him put his foot, his paw
Wow.
flat on the ground for the first time in months. So I'm like, okay, like this is,
Felt like you did the right thing.
I did the right thing. Yeah. So basically this is kind of like what happened with Nigel. And, they tell you, that, when they tear one knee, they're going to end up tearing the other one shortly enough after. They give you usually a 6 to 12 months range time. And we kind of know now with Dr. Ruth, with what we learned, it has to do with the type of collagen that's in this ligament that becomes like an autoimmune issue. So then the other knee starts to protect himself and attack the body, and damages the knee that's currently the good knee. It starts damaging the ligament in that knee, and then the knee happens, the same thing happens. So about like 6-7 months after, yeah, Nigel tore the other one. So needless to say, with the experience that I had in the first with the first knee, with the surgery, I said, there is no way that I am doing a surgery So what are my options? So I always, I used acupuncture on myself for a long time, and I had like good success with that. So I said, I need to find like a good acupuncturist that can, come and start, because they were trying to do acupuncture on Nigel at the physical therapy center, but there was so much going on with them. And it was like, with all these months, like seeing vets here, vets there, that, he didn't really like vets too much at that time. So he was a little difficult. He became a little difficult to work with. So
It gets hard on them. It gets hard on them.
yeah, so they were never able to do it, but I know my dog, and I said, you know what, if I find someone that can come over to my house in my presence in his house, we're gonna be able to get it done. So I found a vet, a really good, Dr. Pertino, a really good acupuncturist vet that comes to your house. She's in-house. So we started like doing acupuncture for the second knee. We started doing acupuncture. We added some Chinese herbals, and we ramped up supplements. And shortly after that, I changed his diet from kibbles to real food, real fresh food.
So what made you change your mind on the food?
That's a good question. I don't really know, but I said, this kibble stuff, I just started like researching more and things popping up, and I'm like, oh, this isn't really not good. It's like practically you're giving your dog a bag of inflammation. It's like, here you go, take this, you'll have inflammation everywhere, pretty much is what you're doing. So, just from researching and listening to different vets and different places, I said, I need to stop that. And, who wants to eat this stuff like every day for the rest of their lives? It's probably going to be a lot more excited to have like a different diet. And
right. Well, we kind of say in the holistic circle that we shouldn't be surviving on cereal and some supplements, and neither should our pets. And that's basically what kibble. Wow. And that's really what kibble is. And one of the benefits and wonderful things that we learned through Dr. Ruth's program is the benefit of fresh whole food and its capacity to feed the cells and give the cells the nutrients that they need so that the cells can fire the organs and power the joints and the ligaments and the brain and the heart and all the things. When we get into it, we find out more. I call what Carolyn did the doggy mama digging in. I had a similar experience when I had to do the doggy mama digging in and figure out what I was going to feed my little pumpkin, or she wasn't going to last long. And it was at that time that the wool just kind of gets pulled out over your eyes, and you learn a little bit more about the process that goes into kibble. Now, we never want to shame if there is anybody that is feeding kibble, but we encourage everyone to find resources like us that can help guide you through what fresh feeding may be like, or even add some fresh to the bowl to freshen up the kibble a little bit. Because when the kibble goes through the process and the high pressure processing that it does, a lot of those nutrients may be good going in, but by the time they get processed, they're not good coming out. Between rancid oils or oxidation, like Carolyn said, it turns into a big bag of inflammation. And as our pets are living longer, which is amazing, we are also facing an epidemic of pet health issues, mostly revolving around stuff that is inflammatory, from IBD to joint issues to kidney health, all of these things, right, Carolyn? So keep going on your journey of kind of finding that. I always like to add a little bit there for any of our pet parents that are watching the benefits of fresh food. And of course, there is a link to Carolyn and I's and links to the pet health coaches in our comments. If you are interested about finding out more about fresh food feeding or consulting with any of us, we are here. Thanks, Carolyn, for letting me.
No problem. I'm going to add something to what you said, because, the pet food, the kibble and pet food is made in big manufacture plants, and you don't really know what goes in there, like I'm gonna say something. Someone I know here in Miami used to work in a sugar factory, and he told me, he said, listen, he said, if you would see the things that go in there, like the rats, the mice, the cockroaches, that they fall into those bins, and they're being like, processed, and they're, go through, they come out like in your sugar, and they don't take time to go and say, oh, let's remove, that spider, the cockroach here and that, they don't care. So it's just like they fall into those big bins where the sugar is made, and they're not. So the same thing probably happens, with your pet food, God knows what else that is really going in there. So anyway, I just wanted to make that
The
comment.
moral of the story is no packaged processed food for humans or our pets, right? That's really, from a
Right.
holistic standpoint, that's how we're all meant to be operating on fresh whole foods.
Right. So imagine if they don't care about what goes into the human food, and when it comes to your pets, they care even less.
Yeah. Yes, I agree. So how did you find Dr. Ruth, our amazing Dr. Ruth, our leader, the original pet health coach, and our mentor?
Well, I had heard of her. So, like over the past few years, I've stumbled upon a lot of more natural, integrative type of doctors for humans, and for, then I started searching, for pets, and I kind of had heard of her. I was, for some reason, and then, she popped up in my feed with that course, and I had been like searching in my head, because, I really like the natural health, and I love animals. And I kept saying, what can I do? Because so many people don't know that they're not doing it on purpose. It's just, they don't know the information of the things they give to their animals, what it really does. So they just, it's important that all the risks, and all the other options that might be better for your pet. But most people don't know, because most vets don't really talk about all the other options. They usually have one option, and that's what they think works, when there's different things that can work. So
You bring up a good point, Carolyn. I always like to say on here, and I know we talk about it too, that I like to think of holistic pet health coaches as the bridge between veterinary care and their pet parents, because we have the background in functional medicine. We have a background in TCVM, traditional Chinese medicine. We have a background in nutrition. And our experiences vary. Like Carolyn is more geared towards dealing with some of this cruciate stuff when it comes to orthopedics and it comes to what's going on with the joints, where other pet health coaches may be more geared toward IBD or kidney or Cushing's. There's a variety of things. So there's really all those benefits that go along with it. Don't you think?
Yeah, there. And like, for Nigel, his second knee, when it tore, I dealt it was only natural. It was the acupuncture, the herbals. Eventually we added an custom made brace, because Nigel is very active, and I had it broke my heart to keep him from letting him go loose and do what he wanted to do. So I felt like I needed to do a little bit more. So we did a custom made brace. And with that, he was able to, go to the park and run and go swim and do his activities while we were continuing, the acupuncture and like that surgery that ended up in a second surgery, and all the complications, and then the allergies that were created because of that, versus the acupuncture and the brace. That was a lot more peaceful, a lot more easier. My dog was able to do what he wanted to do. We were sleeping well, and it was like a whole lot easier. So
Yeah.
I would definitely, learning from that is, I'm always gonna leave the riskiest, for last. Try everything you can, and if nothing works, then you can consider the surgery.
How did you see Nigel's health improve when you were incorporating more holistic modalities, and what medications were you able to take him off of?
Well, he was never, aside from all that time when this surgery was happening, he was never on medication. I'm not a big fan of medication. I always tried, unless it was an absolute necessary for the pain after surgery and things like this. But when I did change his food to fresh food, like immediately, like within a few weeks, like I saw his energy level, like really like go up, and I could tell like this was making a difference. I'm like, okay, well, this is good. Now he's not touching, like, don't give a kibble to my dog, like, he's only eating like the best organic. If it's not good for me, it's not good for him. So that's how I see it. If it's not good for us, then it's probably not good for them. So would you eat it? Would you consume that? You have to. If you wouldn't, then why would you give it to your pet? So yeah,
Well, a
definitely.
kibble doesn't seem as appealing after you put it like that, right?
Right. Yeah. Yeah, I mean, it's just, pretty self-explanatory, like the kibble, you don't know, number one, everything that's in there. You just don't know. And number two, all their long list of ingredients that most of them, you're not sure what it means, chicken by meal, and they have to specify that it's real salmon and all kinds of words that you're not even sure of. And then the vitamins that they have to add, they're being cooked on top of it. So they're not even fresh, so that they lose a lot of their potency. Versus, you go to the grocery store and you pick the food and what you choose, what's on your kitchen counter when you prepare the food. So what goes into your dog's food when you cook it, or your cat's food when you cook it.
And their system really doesn't know what to do with the synthetic vitamins either. Once it gets cooked, it's in a form that's not necessarily bioavailable to them. And synthetic vitamins can increase and exacerbate any nutritional imbalances that are already going on, especially if the same thing is fed every day. Carolyn and I have really learned the power and the magic of rotating proteins as well.
Yeah.
That's something that we learn as part of Canine Nutrition and Dr. Bruce's program. When we rotate proteins, we are giving our pets a more complete amino acid profile. There are studies that release that cats and dogs, we always say that there's a protein requirement. It's actually more of an amino acid requirement, and those amino acid profiles are specifically found in meat. And so fresh meat is really the most important to them. Tell us more about other improvements that you saw with Nigel, and what else did you incorporate to keep him out of pain?
Well, the acupuncture, which, acupuncture is great because you can work on multiple things at once.
Mm-hmm.
So as we were doing the knee, we started, because he had, like I mentioned, had allergies, and he was, starting to, get better when acupuncture. We also, managed the allergies with acupuncture. Omega-3 is a good supplement that I started. I think he was already on taking glucosamine before, but he was taking like the cheap Dasuquin kind of, so I changed around some to better quality. Yeah, I started looking into the quality also of the supplements, which is important. So I pretty much, I want to say a combination of all these things, the supplementation, Chinese herbals specifically for tendons and ligaments. We added that, the red light also. We started the red light therapy.
Yeah.
So
Did you do PMF too? I know we like to talk about PMF. That's
do
great.
it now. I do it now, but not back then. But now I do have my mat, his mat. I have the assisi loop. So I'm pretty well equipped now. I have an ozone therapy machine. I have like the red light, my own red light. Obviously they're not as strong as the ones that the vets use, but it's good to have all those things on hand. So.
And PEMF, by the way, is pulse electromagnetic frequency, if anybody's wondering. And it's a frequency that they say is geared towards the same frequency for pain relief or stress relief, the frequency that your pet is at. It harmonizes that and adds some frequency and vibration for, you can set them to different things, pain release, stress release, whatever. And those are, you can ask Carolyn how those are available, because that's something that we can get through Dr. Ruth's site and through Carolyn or me or any of the pet health coaches.
Yeah.
Was CBD incorporated with
At that time, CBD was not. Right now, I do have. I am using CBD on a regular basis. I use the CBD Dog Health Heal. Yeah, I do. Now that I know, because I was always kind of afraid before. I didn't really know, and you're like, oh, I'm giving THC to my dog. I don't know, is that safe? But now that I know, that I've learned about it, and it's completely safe.
And there's no THC.
What's that? And say that again.
There's no THC. Well, there can be, but in the CBD that we like to recommend, CBD Dog Health, there's no THC.
Right. So now, like I use this, and definitely I see, Nigel is 12 years old. So he's doing pretty good for a dog his age. He jumps everywhere. He's fine. Occasionally, rarely, but occasionally he has like a little neck stiffness. So then the CBD will work pretty good for that. But back then I was not using CBD,
Yeah. Well, I'm so pleased to hear about your journey and how things are progressing with Nigel. You've recently had some good news with him. He had another surgery that you're really nervous about, and you had a cancer scare, and it turns out everything is okay.
Yeah, actually, it was a surgery that did not happen.
Oh, that's right.
Right, that did not happen. A couple months ago, when we did his regular routine ultrasound, they picked up a large mass on his kidney that was not there last year. So right away, they go to the cancer ward, because it was a fast growing, considering it wasn't there last year, and because of Nigel's age. And I was always like, no, that's not possible. That's not possible. But, the only way to find out what it really is was to remove the kidney, because doing a biopsy is doing a surgery. And since the mass was large, well, there's no point of doing a surgery and then going back again if it would be cancer too. So, they say we just remove the whole mass, and it's going to be the whole kidney because of the size of the mass. So I did not panic. I said, okay, hold on. Let me do my research on large kidney masses. And so finally, like when you search for that, oftentimes you will see large cysts. And I kept thinking, well, it could be a cyst. It could be a cyst. But they're like, no, the vets were like, the surgeons like, no, most likely not, because of his age. It's probably cancer. And I'm like, well, we don't know that until, we take out the kidney. So it could not be cancer. So
yeah, thank goodness.
Yeah. So I started.
I'm relieved for you.
Yeah. So I started treating it as if it was the worst case scenario. And I started going hard with like natural protocols for anti-cancer. And we rechecked the mass through ultrasound, and it had grown a little bit. So then I was kind of faced to make a decision. Even though deep in my mind, I was like, because I do so much for prevention for Nigel, and not for that not to happen, I was just like, it's not possible, that he would have cancer. I have a hard time thinking that, but I hated the fact that I needed to find out that I needed to remove the kidney, right? To find out that. So we scheduled the surgery, and the day of surgery, I got very lucky because they do a CT scan. We scheduled the CT scan prior to the surgery. They just, they usually check to make sure everything.
Anyways.
Right. So at the time after the CT scan, the surgeon called me and he said, look, I'm here with the radiologist and we're looking at this mass. And the more we're looking at it, it's looking more like a benign cyst. So we're pretty confident in that. We're not 100% sure, obviously, because you're not
Yeah.
never 100% sure until you have a piece of it and you can analyze it. But
Yeah.
so they said we are not recommending to remove the kidney anymore. We're going to recommend to drain the cyst and send the liquid for cytology and see, if it comes back as anything. And that's kind of like, or you do nothing and leave it like that and keep watching it. So I said, okay, let's drain it and send it, so that this way I'll have peace of mind and I'll know what I'm dealing with, and then I can take the proper measure to have a protocol for whatever I'm dealing with.
Yeah.
So yeah, so the surgery, Nigel his belly was shaved, but his belly was not cut open. So I was happy to, that we did not have to remove the kidney, and then the cytology came back all clean, nothing. It was a cyst, so it was nothing more than that. Yeah, I know, big relief for sure. Yeah,
Yeah.
yeah,
I mean, because that's scary stuff. And those are the words that no pet parent ever wants to hear. But, that's part of the reason we do what we do, right, Carolyn? We want to set our pets up for the
yeah,
healthiest, longest lifespan possible. And inflammation is at the root of all disease. And so when we can keep them eating healthy, fresh food and keep the inflammation down, then we're giving them the foundation for a pathway to health and the possibility to live a wonderful, long, happy, healthy life. And I'm so glad that we're on this mission together, Carolyn. I have a
yeah.
couple more questions for you. So
Okay,
I'm going to kind of put you in the cruciate orthopedic
okay.
specialty kind of area. What supplements would you recommend for pet parents that may be dealing with cruciate tears or dysplasias and conditions of that sort? What are some of your
Well,
favorites?
Well, the first one I would start with is omega-3. Like,
Mm,
probably if you know that this is an issue, I would do it on a higher dosage. If you want to prevent, then just do a lower dosage. But if you are dealing with the issue, I would definitely do a higher dosage. CBD, CBD for sure. Um,
Did you use mushrooms?
I'm using mushrooms. Yeah, right now I'm using mushrooms.
Mhm.
Yes. I would say, yeah, omega, CBD, either green lip mussel or glucosamine or I can't ever say
Hyaluronic acid. I know
yeah,
it's a tough one.
I can't say that
It's a
word,
tongue
but yeah,
twister.
yeah, I would say that. I would say, if you can get like your hands on a small red light therapy device, they have some like the one I have that you can use at home. I would use that PEMF. If you get a PEMF mat, you can use it for you. If you have multiple pets, you can use it for more than one pet. Those are
Uh-oh. Are you doing okay, Carolyn? We might be losing Carolyn. Where's she at? Okay, we're gonna hang out for a second and see if we can get her back for a minute. I'm just gonna try something real quick to see if I can get Carolyn back. And in the meantime, uh-oh, we'll try again. So in the meantime, excuse me, if we don't get Carolyn back, there is an important event that I want to talk about that is coming up on Sunday. We have the Know Better, Do Better event in Chicago, and Dr. Ruth is hosting along with many other brilliant minds. There's going to be holistic pet health coaches there, and it's going to be a fantastic event that we're all really looking forward to. I'm going to be there in spirit. Unfortunately, I can't attend in person, but big hugs to all my pet health coaches that are going to be there. And of course, to Delora DeVore, she is our program director. And of course, to Dr. Ruth. Oh, did we get Carolyn back?
was that
There she
me?
is.
Was that
Thanks
my
for
internet?
leaving me hanging, Carolyn.
Okay,
Okay.
I don't know. I guess it was my internet. I don't know what happened. I was like,
It's
what
okay.
happened here?
It's okay. I was
Uh,
just in my own little island for a little while without you.
okay, sorry about that.
It's
I
okay.
was
It's okay. We got it. We got it.
Yeah, so I was at the physical therapy. So yeah, I would do like some swimming is good if you have a place that you can safely take your pet swimming. Swimming is a good way to exercise when you have some orthopedic situations, and you just find some YouTube exercises for what particular, if you're looking for the knee, just go and search for dog knee exercises, or to strengthen the knee muscles and the muscles around the knees. That's what I would do.
Yeah.
But
so much good about. So one last thing I want to ask before we get to my favorite part. You already know what it is, but
yeah.
I want to know, what do you feel like is your specialty? What's really near and dear to your heart? And when you have pet parents that come to you as a holistic pet health coach, where do you feel your niche is? How can you help pet parents the most?
Well, I'm pretty big on prevention stuff, because I'm kind of terrified of cancer, so I'm always researching about how to prevent cancer and things like this, and so I kind of have some knowledge of that for human size, and a lot of the pets is a lot of things can be applied to the pets. So I definitely can help people that want to start on a preventative path. And I think two things that every pet parent should do is definitely that's detox and boost the immune system. Nowadays, unfortunately, the only thing left in this world that's pure and clean and real is the love of an animal. Nothing out there is clean and pure anymore. The air, the water, the soil. So we have to detox on a more regular basis. So you can detox 1 week of the month, every month. Say the first week of the month, you'll do a detox. Back then 20 years ago, you could do a 2 weeks detox for the year and you were good. But today there's so much toxic stuff coming at us and at our pets, even more because they're lower to the ground and they inhale things and they walk barefoot. So I would definitely recommend everybody to have some sort of detox protocol that they do on a somewhat regular basis. And then also, things to boost your immune system, boost the pet's immune system, like vitamin C, mushrooms, and things like that to prepare, to prepare and to
I
be
might
able
need to pick your brain a little bit more on that later.
Yeah.
Well, and that's another good thing about all of us holistic pet health coaches. We pick each other's brains. We're constantly learning. Our education never ends. We're always in lectures with guest veterinarians, with Dr. Ruth, and with each other, where we get to pass back information back and forth. And another benefit of working with a holistic pet health coach is we've got Dr. Ruth behind us and we have each other. So if there's something that we're not quite sure on or we don't know, I can guarantee that one of us is going to know something good.
Right. Just between all of us, we have seen so many different situations that we are working together on everything. And if you don't know, if you've never encountered this for your clients, someone else in the group will have, something to say about it. So.
Yeah. Well, fantastic advice, Carolyn. So guess what time it is? Oh, yes. I missed. It's time for pet perks and pet peeves.
Okay.
Did you get it ready?
Yes.
So, I'll explain. Pet perks are the top 3 things that you can't live without in the pet world, and it can really literally be anything. But I always like to know, and I think it's a fun way to share your knowledge and some of your favorite products or whatever it is with our audience that's listening. And pet peeves is, if you could wave a magic wand, just wipe it off the planet, we'd get rid of it. So what should we do first? Should we do pet perks first?
Yeah, let's do pet perks.
Let's do pet perks.
Okay, so my first pet perk is definitely acupuncture for pets. So I'm very happy that it's becoming more available. It's still not available enough. I wish there were more acupuncturists for pets, but definitely can help, tons of issues at the same time. And it's traditional Chinese veterinary medicine. Everything works together. So you need to make sure that the energy is flowing. And just by sometimes making the energy flow the right way, you'll unblock a lot of issues in the pet's body. And then you can also work on specific things, so that's, I think every pet should get acupuncture if they can.
Fantastic comment and concept, the concept of, when you think about it, we're entirely energetic. And to think that energetics wouldn't play a role in our health or our pet's health is doing us a disservice. It's very important to incorporate that.
Yes.
Okay. What else?
My second one, I just want to say, swimming, beach water exercises for dogs. Like I love to, Nigel loves to go to the beach, swimming, paddleboarding, kayaking, and at the same time that it's a fun thing to do, like it's working, his muscles in a way that it's not, too harsh. So it's, something that if you are lucky like me and live close to the beach and in a beautiful, environment with a beach or a water, so take advantage of that and go swim with your dog and exercise, especially as they're getting older. It's the best way, to, every vet will tell you, swimming is probably the best exercise for your dog. That's number two. Number three, I'm just gonna say, I just love going to pet friendly places, and where I live, there's tons of them. So I always like to, if I travel, go find like pet friendly places to go. And you just meet, you always meet good people. It's easy, when you have a pet, you go to a pet friendly hotel, you'll meet like tons of people. It's just like a good vibe. So
I like that. You're in Miami, right?
yes. Yeah. We have a lot of pet friendly places.
It's so nice to live when you're in a pet friendly area, and you can take your little pumpkin with you everywhere. Mine are homebodies, though. They don't want to go. Well, cats don't really want to go anywhere, so scratch that idea. But
right. Maybe not for the cats, but the dogs, yeah.
Yeah. Okay. What about your pet peeves?
Well, my first one, fleas. That's like probably the worst.
Is anybody else pulling their hair out this year? I mean, fleas they have really been little beasts this year. I think everyone's about darn over it. What do you do about fleas, Caroline?
Well, I struggled for a long time because when I stopped Nigel he used to be on Trifexis, so I stopped him doing Trifexis. So about 5 months after I started, he started having fleas. So then I'm like, oh. So I tried a lot of natural things, between the essential oils that are already come pre-made, then some powder in the food, and I've tried a lot of things. Sometimes things would work for like 3 months, I'd be clear, and then all of a sudden fleas. And if you've had a flea, and it's like a full-time job, you can't
you can't let up.
You can't say, oh, I'll deal with it tomorrow. It's like you got to get on it now, and everything, the dog, the carpets, the house, clean everything, and it's just like never ending, and it's a nightmare. Until Nigel's acupuncturist told me that she had some clients that were using the ultrasonic tag. So
okay, interesting.
Yeah, so I said, okay. I said, let me try that. So I ordered the Easy Defense ultrasonic tag, and it usually says that it takes 3 to 4 weeks that it starts.
Okay.
To work after 3-4 weeks. So after 3-4 weeks, it was not working. I was like, oh, I'm like, let me leave it on. So it took a good 7 weeks for Nigel for it to start working.
Oh, wow.
But it did start working. So
that's interesting.
And now it's been like about 1.5 years, and I saw one flea once because I kind of forgot to put I was traveling and I had forgotten the necklace in the room. So that's the only time I saw a flea in about 1.5 years. So I can tell you that I'm very happy.
So the moral of the story is consistency is key when it comes to flea control. I've had good luck this year. I do an essential oil spray, but everybody please make sure that they are the right essential oils and the right mixture or
Right.
concept. We have a holistic pet health coach, Audrey Moina, who is fantastic at that kind of stuff. If anybody has any questions, she's in the comments right now and you can reach out to her. So make sure. And I've been using the Amber Collar this year, which is also available on Dr. Bruce's website and through Carolyn and I've had fantastic success with it this year. I so surprised. I saw a couple of fleas at the beginning of the summer and none since then.
Yeah, that's a
I
good feeling.
don't want to provoke them to come out because I know they're probably listening and like, oh, you haven't seen
Yeah, it's the best feeling.
you. So,
but every dog, like flea wise, like is different because Nigel is like part husky, so he's like got really thick hair that's really comfy for fleas to come and hide, and so it was hard, like a shorter hair dog, but like it depends also, if your dog is a very fluffy hair, you might need something a little bit more like the tag, but
yeah.
you got it. Yeah. Well, I will say, pesticides, because, I always get annoyed when I'm walking the neighborhood and I see them spray pesticides everywhere. I wish that people were more conscious about that and that they would say, let's find a better way to fix this problem. And I live in a building and they come, once a month, they spray people's apartment and they know not to cross my door. Like they have,
good job, Carolyn.
Yeah, they know, like, do not cross this door because if they ever come in here with their,
right.
I'm they never, yeah. So that's probably, what's, because that's something that's hard to control because it's outside. You can control what's inside of your house, but you cannot control all the neighborhood, right? So that's why I hate pesticides, because I can't control what's outside. So
yeah, the struggle is real. You're right.
Yes, and then I have a third one, right? The third one, I want to say over vaccinating, because we tend to over vaccinate the pets, and I just kind of wish that people with the states and would consider seeing a titer as something that should be, instead of the over vaccination. A titer is when you check your dog's blood and against a specific disease, they're going to check the level of antibodies. And when your dog has enough antibodies in the blood, then that means they're protected for that disease. So in that case, there should not be a reason to vaccinate if he's already protected. But I don't know how many states allow titers to be
not many, as far as I know. And you kind of brought up a whole nother topic, and I'm glad you did. I think that we've talked about, and you're aware of, there has been a kind of gnarly petition that has been circulating around about mandating a certain vaccine schedule for pets that may or may not include core vaccines. Once again, our concern is for the over vaccination. When you're in the holistic community, we like to look at the body as a whole. And of course, we have to look at the impact and some of the impacts to immunity. There are side effects that can happen with vaccines. And I think the moral of the story is parents really have to do their own due diligence and do the research. And if you're interested in titers, I did put a website up, Titers for Pets. It is my understanding that you can order them through there if that's something that you'd like to do. So how often do you get your pet titered?
Me?
Yeah.
Once every 3 years.
Yeah.
I mean, because technically the only core vaccines are the parvo, distemper, and rabies, but his titers always come out plenty high. So I think we need to put a petition for titers to be recognized, because
that's a great idea, Caroline.
it's the same thing, you know. I mean, why would you give something like a vaccine to your pet that has like a thimerosal, that's a mercury that can go to do brain damage and other ingredients that can, you know, affect the immune system, versus just doing a blood test that will tell you, hey, you do have enough or you don't have enough. If you don't have enough, then okay, then you can consider maybe doing the vaccine. But if your pet already has the protection, you know, why would you go and add more of something that's, you know, could do more damage than good? So I think that, you know, this should be something that
Well, and the
people have.
research shows that right now, the immunity, more often than not, and generally, I should say, the immunity that the pets that are getting from their initial shots far outlasts the recommended schedule by years.
Yeah.
And by
Well,
years. Some are
if
saying
you,
7 or 8 years, if not a lifetime. So
yeah,
that's something that we, as holistic pet health coaches, can address. Reach out to Carolyn if you have questions about vaccine schedules or titers. It's also going to be something that will be addressed by a colleague of mine, Melissa Sherman, on our holistic pet health group with Dr. Ruth Roberts. If you are a member of that and interested in finding out more. Did you want to add anything else about that, Carolyn?
yeah, I was just gonna say that, you know, usually when a vet becomes a vet, they usually have to get the rabies shot, right? The rabies vaccine. So the vets get the rabies vaccine once, and it lasts what, 30 years of their career. So why would a pet need to do it every 3 years, right? I mean, it's the same shot, but you know, so I just don't
Bam.
understand, you know. I mean, I don't know. That's how I'm, you know, looking at this. Why does the vet that's dealing with dogs all the time gets the vaccine once for his whole career time, and then the pet has to get it every 3 years? Just something
I have
doesn't.
never heard anybody put it like that before. That was low key brilliant. Good question and a good thing to ponder.
Right.
Yeah, that was a good point, Carolyn, and thanks for bringing that up. Is there anything else about you that you would like to tell us and anybody who's watching and is interested in having you as their pet health coach?
Well, you know, I mean, reach out to me. You know, my goal is to educate you the things that I did not know about, like a titer, for example, all these things I did not know 7, 8 years ago that I know now, that I can, you know, help you with, instead of, because, you know, it's so overwhelming. There's a lot of things out there that, you know, it takes a long time to figure out something sometimes. So we already know a lot of that. So just, you know, reach out so I can guide you. You know, you can still make your decision, but I will give you all the options that, you know, for example, if you have a knee situation, you know, there's not only the surgery, there's other, you know, ways to, you know, heal the knee. So I will give you the options available. You decide what works for you. And, you know, I'm there to like kind of like guide you and educate, to make sure, you know, your pet chose you and your pet trusts that you're going to do your research and that you're going to know every available option for them before, you know, throwing yourself at something that you are not sure about. So they trust that you're going to do the same research you would do for yourself. You know, they trust that you're going to do that. So I'm hoping, you know, I can help you with that.
Yeah. Carolyn's website, she is with Possum Holistic, and there's a link to it in the comments, possumholistic.com. We thank you, Carolyn, so much for joining today. This has been a great live, and I really appreciate all of your knowledge and experience when it comes to some of the stuff that Nigel went through, and especially the stuff that has to do with the cruciate stuff. That's not my specialty. So once again, it's nice to talk with somebody and collab on something for the benefit of all, because we're really on a mission. You're right about us being guides. We've all been through so many experiences. Carolyn's got years of experience behind her with things that she's gone through with her dog. And I know that this has kind of been a mission for me for the past 10 years. And it is a mission because incorporating holistic health and fresh food and having options and being that bridge and that guide for pet parents is super important. Because like you said, I didn't have a guide when I was going through all this. And I wish I would have had one of me or one of you back when this started.
I think sometimes my friends probably think I'm annoying because I'm always like, did you see the ingredients that in is what you're drinking or what you're using, the products you're using? But, I wish someone like 20 years ago would have told me, hey, listen, there's an ingredient in there that causes cancer. Don't use this product or this or that. But because I'm always like, I'm just doing it to look out for them. I maybe sometimes they think I'm annoying, but
well, then I'm equally annoying because I'm that person too. Did you read what's in that?
I what?
Eyeball rolls come from my husband. What are you eating? Does it have seed oils? Did you read that? He always says, he goes, why does Darla eat better than most of us? I said, I don't know. Maybe we should eat like her.
Yeah. I think Nigel's food is pretty good food. And Nigel, I'm not I'm not crazy about cooking. So Nigel, he gets his food from Lucky Duck Cuisine, but they're all like, they check mark all the boxes on the Susan Tixton, The Truth About Pet Food list. So
yeah,
organic, non-GMO, no seed oils. And, he eats better than me.
Yeah. Wonderful. Well, we are going to head it to our weekend. Once again, don't forget Chicago. If you're in Chicagoland, please check out the Know Better, Do Better. There is a link to the event in the comments. Please check it out. So exciting. Also, if it resonates with you about holistic pet health care, once again, reach out to any of the holistic pet health coaches. There's a link on here, or Carolyn or myself, or if you're interested in being a holistic pet health coach, also a link in the comments. So sorry, I keep dealing with this little frog in my throat today. So sorry about that. Have a wonderful weekend, everybody. Carolyn, thanks again for joining us. And as always, positive vibes. Take care. Bye-bye, everyone.
Thank you. Thanks.
Thank you.